Hi, my name is Hillary Kane, and I will be introducing you to the learning method of case studies for our Nursing 322 teaching and learning class. First, we will go over the objectives for this presentation. By the end of this presentation, the learner will be able to describe case studies as an instructional method. The learner will be able to provide information on the domains of learning for case studies. The learner will be able to state the pros and cons of case studies as an instructional method. And lastly, the learner will be able to provide examples depicting how to use case studies within healthcare education. A brief description of case studies as an instructional method. These are an approach that offers learners the opportunity to become thoroughly acquainted with a client situation before discussing client needs and identifying health-related problems. This was stated in our text. Case studies lead to the development of analytical and problem-solving skills, exploration of complex issues, and application of new knowledge and skills. I wanted to quickly go over the learning domains that we touched on last week. First being the cognitive domain, which includes all intellectual behaviors and requires thinking. Secondly, the affective deals with expression of feelings and acceptance of attitudes, opinions, or values. And the psychomotor domain, which involves acquiring skills that require integration of mental and muscular activity. So the domains of learning for the instructional method of case study are actually all three. So the cognitive domain, as stated by Harvard Law School, engages readers in active learning. This is because it employs discussion between participants. Participants can argue or defend their advice for the protagonist in the case study with prior knowledge. Case studies can teach participants new information, and participants can learn how to problem solve using case studies. The affective domain is highlighted in our text because we can use reflection after a review of a case study. In case studies, participants are in the shoes of the protagonist. They can use how they felt during the discussion of the case study to help them reflect afterward. This could change attitudes on disease processes, change attitudes on a change in policy, and it could even change attitudes on or about a group of people. And lastly, I have the psychomotor domain, which it isn't highlighted nearly as heavily as anything else in the research, but it is used in that after some of these case studies, especially by using evidence-based practice, you do see practice changes, whether that's how we do dressing changes on the unit or other smaller practice changes within the unit. So that I would see as using the psychomotor domain. The pros and cons of using case studies as an instructional method. Pros, you're using your analytical skills, your problem-solving skills. There is a deeper exploration of complex issues. There's also an application of new knowledge and skills. And using case studies creates an open-ended, learner-centered investigation where everything is really centered around the learner and everything is driven by the learner. Cons to using case studies as an instructional method include case studies are very time-consuming. Typically, these require at least one class session if you are in class to fully implement, and other times it includes multi-steps and multi-layers. Typically, case studies are used in conjunction with other learning methods such as role-playing, lectures, small groups, or one-on-one. So it is hard to just employ case studies as an instructional method on their own. You do need to look into other ways of or other instructional methods when using case studies. And this may incorporate additional readings and or multimedia. So students or patients might have to look outside of the case study to really get that strong base knowledge or to completely understand the information presented. And this could also come in as an issue for the nurse that's doing the educating, because now not only do they need to prepare this case study, but they also have to have these other resources, which can be time consuming, especially for a busy floor. So examples for when you're using case studies with your peers. Our text stated that one way to use case studies as an instructional method with our peers is by creating a panel presentation by clients who are coping with a specific disease or problem. This would allow peers to let go of negative stereotypes, learn new information, or bring in evidence-based practice. So I looked at this as there is a panel of experts, whether that is, nurses on your units being an expert in something, or a panel of clients who are an expert with their disease process or, symptoms of a disease. The peers on our units could ask questions in a more relaxed environment, and this could bring about positive change on a unit. I see it as less resistance to change if the staff understands reasons for a change, especially with using evidence-based practice. There is a lot of resistance typically on a unit when you first want to change something. There's always this, well, why? We've always done it this way. Having a panel with experts and using, evidence-based practice, allowing peers to ask questions and to investigate further as to the why behind it can lead to a more relaxed environment on the unit and will allow for more nurses to contribute to the change in a positive way. Use with the patient. Case studies allow patients to make mistakes. So here I have written there, you can use case studies in a role-playing setting, which will allow the patient to make alternative decisions, or it could point out where the subject in the case study went wrong. So I like to use the example of, a case study where there is a diabetic patient, and this patient, instead of making diet and lifestyle changes, they are changing around insulin and how much insulin this patient is getting each day. This would allow maybe the patient that you're sitting with to think, what is this patient doing? What could I do differently? And this patient could make alternative decisions instead of what the case study is saying. It also allows the patient to make mistakes within the confines of the case study. So the nurse is there next to them saying, well, maybe this is a good idea, maybe this would be a better way of going about it. But the patient won't hurt themselves by going over the case study. And lastly, how to use case studies with students. Here, the learning experience would be in a controlled environment. So the nursing instructor or the nurse with the nursing student, we would control the environment. Here, students could make clinical decisions without detrimental repercussions. This would mean that it's a safe place to learn and patient safety stays intact. So a nursing student could suggest an idea, and if it might be the wrong idea, yes, in theory, this would hurt our patient, but because we're not actually with a patient, no one is harmed in this, and it's a very good learning tool. And lastly, students can explore the decisions of others. In a case study, they can explore more experienced nurse decisions, and they can stand to gain a lot of knowledge this way by learning from others around you and learning maybe from their mistake or seeing why they made certain decisions can really help a new nurse or a student nurse in their path to making the correct decisions. I really hope you've enjoyed this presentation on case studies. Please, if you have any questions, leave them in a comment and I would be happy to answer them. And here is just a quick list of my references for this presentation. Thank you so much.